Nebraska ranks 7th in the nation for incidence rate for pediatric brain cancer, and they're number 1 in the Midwest, which is also kind of a staggering fact given our location. And so there is a huge problem with brain cancer right here in Nebraska, which is why we decided to commit $6.5 million to the brain tumor program here in Nebraska at UNMC and Children's Nebraska. We wanted to ensure that when a family is diagnosed with brain cancer in Nebraska, they have access to the best care possible without leaving the state.
Like any successful big center in the country, you need a multidisciplinary team. That includes things like our neuro-oncologist, medical neuro-oncologist, our neurosurgeons, our intensivist, our social worker, et cetera, et cetera. And the reason for that is because these lesions are so challenging to treat, and therefore you need to have expertise in different domains and be able to bring all of those at the same time to the table and discuss.
Most of our patients travel hours before coming to us, and if we are not here, they would be traveling even further out to go to a different center, which probably would be 7 or 8 hours away from here. And in the last 3 or 4 years, we have made progress, and progress that is meaningful, not the same previous chemotherapy agents that we have been using for years. We are coming up with new compounds, how to treat this tumor and how to treat them effectively with least amount of side effects. Team Jack has been phenomenal in helping us with that, right? With resources. They have funded positions for the clinical trial coordinator for me. They have funded positions for patient navigators. They have funded my travel for additional expertise in the field of pediatric neuro-oncology. They have been very supportive in this. As I said before, they have funded the development of a medicine called Day 101 or Torafenib, which is the huge success story in the world of pediatric neuro-oncology.
I don't think there's a single state in the US that has this type of collaboration that started with the work of a foundation which all started with a child's experience at the University of Nebraska. And I think that's what connects us so closely to each other. When we think about Team Jack, we don't think about it as a large foundation that's in the ether somewhere. They are very much grassroots. They're very much friends and coworkers. They're people that we sit together and talk to on a regular basis and that we relate to. We knew the Hoffmans personally, and so it really feels much more like a family than entities and institutes working together. It's much less sterile and it's much more collegial. There's a warmth there, and I think beyond the breakthroughs, it's the warmth that emanates and that helps us all support each other and pushes us to higher and greater lengths. This is what Team Jack started, and this is the legacy of the Hoffmans, and it's our responsibility to continue that, to grow that, and to make it matter, to make this fight matter for all the children that gave up their lives for the work that we are trying to do to save the children in the future. And Team Jack cannot be lauded enough for who they are, who they continue to be, and the work that they're continuing to do. It's more important now than ever.